Welcome to the Federal. Union Health Ministry's new campaign to display oil, sugar boards, and trans fat content information in snacks like samosas, jalebis, pakoras, fries, and many others is an initiative aimed at promoting dietary behavior change, especially at workplaces. Joining us today to discuss the same is Dr. Dharini Krishnan, a renowned senior dietitian, who will be sharing her insights on how this initiative can be effective, or how effective can this be in promoting the healthy habits in the general public. Thank you so much, ma'am, for joining us.
Pleasure. Pleasure is mine. Thank you, Shweta.
Yeah, ma'am. So, first of all, I want to know, like, what do you think of this initiative of displaying sugar and oil boards at food counters, especially at workplaces?
It's extremely good initiative because people are not aware of what is the calories they are taking. So if we actually put in the oil and sugar boards, there will be some kind of knowledge that comes. Of course,
Right.
it will be only a percentage of the population who are really going to take in the knowledge and act on it. But at least the initiative start is very good,
Right.
because it's important for people to know. People are not aware in India of what are the calorie they are taking through these kind of snacks.
Right. So, ma'am, like when we talk about the snacking habit, I think it's there throughout the country. Now that the junk food system is becoming quite common and popular, there are a lot of lifestyle diseases that these cause. So, what kind of lifestyle diseases do these snacks lead to if consumed on a regular basis?
See, a very simple thing is India is going on to a stage where we are having huge obesity. Overweight
Right.
it starts with, then move to obesity. Before it was adults, but today it starts in children. Children as young as 10 years or 8 years are really heavy. In my clinic, some of them who walk in at 10 years are 80 kilos, which is heavier than what adults should be. Because an
Right.
average Indian is normally around 5'10" or 5'6" or 5'8", which means their weight should be within 60 to 70 depending on their height. Right? And that is
Right.
at adult stage, not at children's stage. So
Right.
children 10 years should be just 24 to 26 kilos, not more than that. And they are already three times the weight. So when it starts so young, I am sorry to say, but I do not have scales which can hold the weight of the adults who walk into the clinic, because most of them are above 120, and some of them are very proud saying that we have actually lost weight and we have come to you to lose further. So you can imagine the problem that is existing there. And because of that, if you're very heavy, suppose your weight should be around 65 and you're already at 90 when you're at 18 or 20, they are getting high blood pressure, their early sugars are rising, some of them lipids are rising. So these kind of problems which came at 40, 45, or 50 is coming at 20 and 25. So it's
Right.
really not worth it. We have a good youth population, young adult population, but they have to be healthy. So
Right.
this initiative is very, very good. In fact, obesity is also related to some types of hormone related cancers. For example, breast cancer in women and prostate cancer in men.
Right, 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 ma'am. Ma'am, but like we say that there'll be this the display of nutritional information, or let's say sugar and oil boards. But to what extent do you think it will be effective? Given that, would it influence people's snack choices?
I can talk about my own personal experiences. 35 years ago, I worked with actually a hotel, and I put up the calorie information at that time, 35 years ago. And we had a special menu, a low calorie menu for people who were looking at it. But the hotel removed it because they said people are not interested in the low calorie. When they come to a hotel, they want to eat what they want to eat, right? But today, what has happened is people are really not cooking much at home, or
Mm,
they are using other people to cook for themselves, right? So the oil consumption has gone up. This is a problem. And people think that every day between 5 and 6 or 7, they need to take a fried item, whether it's samosa or cutlets or kachori or chips or whatever it is. So
mm,
here is the problem, where people think that it's a norm to have samosas every day. It's not a norm. Even in the north, people never ate samosas every day. Chaat was made at home and it was had once in a way. Fried items was not a part of the diet every day. But the
mm,
current generation thinks, yes, it is. We need to have it. And the same problem with sweets. They say they
mm,
need to have a sweet after every major meal. Otherwise, the meal doesn't feel satiated. So these
mm.
are the problems. So if the boards are displayed, at least there will be some little knowledge which comes in. For example, let's take a samosa. You have a very small samosa, but it's a packet of five. So they eat all five, which means it's equal to one big samosa. So either
Yeah.
you eat a small, very small one, five, or you eat a big one, one. It is anything from 250 to 400 calories. So if I take extra 500 calories a day than what I need just from samosa, then at the end of the week, I've put on half a kg of weight. This is how it works.
Right. Ma'am, now that we talk about, the effectiveness of how it would, give some sort of an influence on people's dietary habits, what challenges do you think this initiative might face in changing deeply ingrained eating habits, especially for popular snacks like samosas, like you mentioned, samosas, jalebis, or chaats?
See, I can have a healthy chart. I can choose it the right way, right?
Right.
For example, like we have this ragda patties, right?
Mm.
If I can
Yeah.
choose only the ragda part, which is peas, boiled
Right.
peas, and
Mm.
have the coriander, the chutneys, it's still healthy. But the
Right.
moment I add the fried patties, which is, aloo and
Mm.
fried, right? They say it's tawa fried. But even
Mm.
if it's tawa fried, it depends on the amount of oil they are using. See, when
Right.
something is deep fried, it takes
Mm.
oil, yes. But
Yeah.
tawa fried, it drinks the oil fully. So the
Mm.
person who's using it needs to be controlled in oil. So here is the problem. Nobody is saying don't have chart. You can have it once a week. But you need to choose it right. If you want to have it regularly, see, coriander is good, onion is good, the peas is good, or the chana is good. As long as, and they have it boiled, kept in the tawa in the corner. You can
Mm.
ask them just to add the chutneys for the taste, the coriander, the onion, and have the pulse, which is good. So we can change the norms of eating if we are interested. Where there's a
Right.
will, there's a way to go. But we need the awareness first. And for
True.
the awareness, this is an excellent initiative. But of course,
Mm.
it will not reach 100%. It will
Mm.
start. It will
Right.
trickle. And those who are really interested, we handhold the other people to help them move on. So it's a
Right.
great initiative because
Mm.
we need to move forward to
Yeah.
make the people aware. For example, if you take
Mm.
Singapore, the Nutrition Society of Singapore works with the government and they have boards all over Singapore displaying healthy foods, the food calories, and things like that since past 2 decades. So it
Mm.
has helped a lot. So this is the
Mm.
first step we are taking in our country because the awareness of weight and things like that is going up. So it's
Mm.
very good. Of course, it's not overnight. These things
Mm.
will take time, but it's a first step towards health.
Right, right. Ma'am, you give an excellent example of how it is there in Singapore that has the calorie information. How do you think that there can be the visual elements, the nudges like these display boards, they should be designed to maximize their impact on public behavior?
See, actually, there's been an excellent display board which I use in a lot of my presentations where they actually take 1 teaspoon of tomato ketchup, 1 teaspoon of junk food, any food you choose, or one teaspoon of the fizzy drink you take, and it tells you in a graph what is the amount of sugar in it, right?
Mm-hmm.
People think today that chips is a salty item, but it has
Right.
sugar when it's packed. When made at
Mm-hmm.
home, it has only salt, but the moment it's packed, some of the packets have a lot of sugar, which people are not aware of. People are not reading food labels because I worked with the school actually with a nutrition project, and it was amazing how the children were being taught to read food labels. This is
Mm-hmm.
where we need to start. And this I'm talking about fifth standard, sixth standard kids. They would come up and say, this is the food label, and which are the areas we need to look at for health, which are the areas we need to concentrate if we are overweight. So we work by saying, if somebody in your family has diabetes, what would you look at? If somebody had, cardiac disease in your family, what would you look at? And fifth, sixth standard children came out with excellent ideas. Right. So the youth have a lot of interest in these things. We just
Right.
need to channelize it the right way. And the
Right.
step of the government of India in CBSE schools that within 5 kilometers, no kind of junk food should be sold is a great thing. And
Yeah.
same in the canteens of the school. So this is how
Yeah.
we start. I've also worked with the railway canteen where
Mm.
we work by saying give them alternatives of healthy choices. If you
Right.
don't give an alternative of a healthy choice, even if somebody wants to choose healthy, they do not get it. Right.
Right.
And
Yeah.
the issue is food safety. If I'm
Mm.
looking for a salad, I do not know when it was cut and how it was displayed. If I can sell, whole cucumbers, whole carrot, whole tomatoes, washed and packed, people can eat it on the way. It's not that they can't eat it. So we need to also give healthy choices with good food safety so that people can choose them. So these
Right.
are the reasons because a lot of people are saying we need to travel 1 hour, 2 hours, even come by train from
Mm.
different places, which takes about an hour to reach the city we are working in. That means for 8 o'clock they have to reach, they have to leave at 7 a.m. What can
Mm.
they do and what can they take, right? So
Yeah.
these kind of small initiatives can go a long way where you provide along with whatever is there healthy
Mm.
choices then people can take it.
Mm. That's an interesting insight, ma'am, for workplaces and schools who can build on this initiative to promote healthier eating habits. Ma'am, today there was an advice, like a clarification made by the Union Health Ministry, where they said that we are not giving warning labels for Indian snack items or chart items. What we are saying is focusing on promoting eating habits and display of oil and sugar boards. So there is some sort of a debate the moment it comes to Indian snacks. So do you believe that this campaign's focus on moderation rather than like a complete restriction will resonate more with the average Indian consumer?
Everywhere that is the mantra. Because on my diet chart, the foods to include is always longer than the foods to restrict.
Mm.
Because the psyche is very important. You cannot, make a person feel guilty about what they are doing. So,
Right.
moderation is the mantra. It's not restriction, and restriction will not work. For example, there are people who go on fruit diet, liquid diet, only soup diet, only salad diet. But
Mm.
the gates open. The moment they've done it for 4, 5 days, they go and eat up everything and everything because they're not able to control. So that is not the right way to do things. The right
Right.
way is if you're taking a bigger samosa, move to a medium one, and from medium move to small, and it's always one, not 4, 5. And
Right.
the next is make it twice a week, then make it
Mm.
once a week, and then make it even lesser. And there are a lot of healthy snacks. In fact, the initiative to sell whole pulses which is called sundal in the
Yeah.
south, has
Right.
been started years ago and it's available everywhere. So those who are looking for it, they get it. But those who are
Right.
not looking for it, they find
Mm.
whatever they want. So
Right.
everything is there. It's your choice. So your priority to health, then things move better.
Right. Ma'am, as we conclude, I just want to ask one more question that now that there was a Lancet report that said that India is projected to have about 45 crore overweight or obese people by 2050. So this is one of the steps which would help counter the increasing incidence of lifestyle diseases. What do you think should be other initiatives by the government to tackle this growing health crisis?
See, the government, even in, like I said, whatever canteens, even the lowest level or the highest level, they should provide healthy choices affordable to an average Indian. Then
Right.
it works. Because we thought obesity was only in the cities. Today it's getting into the rural
Every-
areas also. So it's very important that people understand what is easily available. It's not a kiwi or a dragon fruit which is healthy alone. Even a papaya is healthy, a guava is healthy. So these kind of messages will carry a big weight. It need not be almonds for the people it is not affordable to. Even peanut, but don't overdo it. That is the important part. So
Right.
we have a multiple variety of foods. The biodiversity of vegetables or millets. We are the highest grower of millets and we have so many different. So if we start making healthier snacks like roasted, sprouted, with all
Hmm.
this and give options to people, they are definitely going to pick it up. And
Right.
that the sodium content of packaged foods is so high. So if we can reduce that and not use the taste enhancers and make it healthier and with less sodium, we are going to be the king.
Right. Thank you so much, ma'am, for your insights. I'm sure there's so many of our viewers would be benefited making, informed choices and healthy eating habits. Thank you so much, ma'am.
Thank you. Pleasure is mine. Thank you, Shweta.